really working hard to get it available in our outpatient areas. And just so you know, we have to do things like we have to have billing structures for it, because we have to be able to give an injection code for it, and so on. It's indicated for patients with alcoholism who can abstain for 4 days before they start. It's an opiate antagonist at the level of the brain opiate receptors. It interferes with we think, with the pleasure of and craving for alcohol. The studies have all been done using it in the context of psychosocial treatment, not exclusively giving you Vivitrol. This XRNTX is the abbreviation for it. 380 milligrams monthly compared to placebo in a 6-month study did pretty good. 2.5 times the response rate, 70% versus 30, about 9 times longer to the first heavy drinking event than placebo, about 3 times greater rate of continuous abstinence, and about a 90% decrease in the median number of heavy drinking days a month. Those are all good things, right? So it looks like it's a fairly robust response. Men had a better response than women in one of the studies. Now, a couple of things to be careful of. You have to avoid it in acute liver disease or liver failure, and you should be cautious with any liver disease. So, of course, the population you're using it in, there's a lot of reasons to be cautious. Plus, a lot of these folks are also using opiates, right? And you can, if you give it to somebody in the face of opiate use, you can precipitate withdrawal, and if they try to overcome it, and let's say they are toward the end of their injection cycle, they can do what we call die from opiate overdose. So you got to be really thoughtful about giving it to people that are also taking opiates. It's also got all of these side effects that sound to me like immunological responses to the vehicle of the injection. So you see the injection site reactions, muscle and joint pains, this sort of stuff, and this type of pneumonia called eosinophilic pneumonia, where these reactive blood cells infiltrate the pulmonary tissue. So it makes me scratch my head and say, what's going on here? Is this drug generate immune responses in some patients? I think I haven't heard that talked about very openly, but I think we've got to be thoughtful about that. It has to be prior authorized, so if you want to prescribe it, you got to fill out this thing, you got to get prior auth. There's a program much like Risperdal Consta that does that, but it's not a buy and bill product. So we don't have to buy it and sell it to the patient, so to speak. But it will be shipped to the office. It has to be refrigerated like Risperdal Consta. And then there's the cost, about $1,000 a month when you consider the cost of the drug and the injection. Now, the pharmaceutical company is a little worried about that. So for private pay patients, because this will be what's called a fourth tier drug, a specialty pharmacy drug, so all the 10, 20, 30, or 50 co-payments don't apply. Your co-payment might be $100 or $200, depending on your policy. They're going to pay your co-payments for the first year. Now, hopefully you won't be on it more than a year, right? Or what the heck is going on?
Question, we got a recommend, Brandon,
yeah.
About a couple weeks ago. He went through the whole thing with the nurses there, and I know it's not a billing by type of an issue like the Risperdal Consta, but a good amount of the population is Medicaid. So how is it going to work with the Medicaid reimbursement? That they can expect.
Well, I'm trying to remember. I've met with Mike, and I met with him a while back. I think Medicaid's covering it.
It's a good thing.
Now, who's going to pay the $3 or $5 copay is the question. I think what we talked about was having a nurse that gives the injection. So what's my opinion about this? Well, it's hard not to get excited about something that seems to work for alcoholism, right? I mean, so far we've really hit zeros with that pretty much. But the track record for injectables over oral meds is mixed for a lot of disorders. Now, why did they turn to injectable? Because a lot of people don't tolerate oral naltrexone well, and they don't adhere to it very well. But how will this go? I don't know. It seems like a lot of patients are going to have side effects. I mentioned I'm a little nervous about what sounds like immunologic responses. And I think it's too bad you can't inject the cost, because it's a little hard to swallow. So there ends my presentation. Any questions or comments people want to make?
Comment that I found very helpful.
Thank you. One person found it helpful. Well, I always worry when people don't have questions, but I'll have to worry about that privately. It's 5 o'clock. If you want to ask questions, come on up. I'm here till 6:30 when the event that's coming in, a recovery event for patients and families with schizophrenia. If you'd like to come back or stay for that, from 6:30 to 7:30, there's going to be a recovery training event.